The first signs of kidney disease are chronic kidney disease, which can also be called chronic kidney failure, involves the gradual loss of kidney function. The buildup of waste, fluid, and electrolytes will cause some clear symptoms to appear in the body. When you notice any of the following signs in your body, it's time to consult a medical expert. Although some of the symptoms may be associated with other conditions, when they appear in conjunction with each other, it may very well point strongly to kidney disease. Feeling nauseous can be a very common part of life, as we may have eaten something that doesn't work well with the body. Or we even get nauseous when we haven't eaten. Nausea associated with kidney disease comes from the buildup of certain medicines and toxins and can even be caused by the body becoming constipated. Sometimes the nausea remains present but underlying, and other times it may result in vomiting. The vomiting may even occur without the person feeling nauseous, or what we call sick to the stomach. This is because the kidneys are starting to struggle to do their cleaning up function properly. In a world obsessed with weight, we may overlook the symptoms of loss of appetite and associated weight loss. Unidentified anorexigenic compounds, as well as inflammatory cytokines, build up in the body, causing amino acid imbalances. When free tryptophan is transported across the blood-brain barrier, it causes low appetite, which often results in uncontrolled weight loss over time. If you've outdone yourself and worked very hard, fatigue and weakness are normal. But sometimes you continue to feel weak without any good reason. When the kidneys have had a severe decline in function, it'll lead to the buildup of toxins and impurities in the blood, causing the energy to not be transported to the cells properly. The situation can deteriorate to the point where there is damage to the muscles and nerves, and it manifests in twitches, weakness, cramps, and pain. Many people complain about pins and needles sensations in the arms and legs, as well as loss of sensation in other areas of the body. Sleep problems are commonly associated with kidney disease. Most of the time, it involves insomnia or sleeplessness. The buildup of waste in the blood can make the person feel ill and uncomfortable. This will make sleeping more difficult. As kidney disease develops, in the end, it's only by dialysis that enough toxins and waste can be pulled from the body to restore some level of comfort. Because kidney function is regulated by the sleep-wake cycle, people who sleep less tend to have a faster decline in kidney function and the onset of chronic kidney disease. We might mistake the swelling of some of our body parts for warmer weather, but in fact, this is one of the most common and easiest signs to detect with regard to potential kidney disease. Damage to the tiny filtering nephrons can cause a decline in the levels of the protein albumin in the blood. This in turn increases the albumin in the urine and causes a buildup in fluid, resulting in what is known as edema. The swelling can be in the hands and the legs, but it's most commonly observed in the ankles and feet. Some people may even experience puffiness around the eyes. When sodium as a waste product is trapped in the body, it can cause a fluid buildup in the soft tissue, causing swelling under the skin. No worries if you drank a lot of fluids the previous evening and you've got to get up in the night to go to the bathroom. When this becomes the story of your life, it's time to investigate. When the kidney filters are damaged, it can cause an increased urge to urinate. This is because the kidneys can't absorb water from the urine to reduce the volume and concentrate it as normally occurs during the night hours. The color of the urine usually does not change, but it tends to become foamy and frothy when associated with kidney disease. In the case of high blood pressure, it's almost a case of the chicken and the egg. High blood pressure will constrict and narrow the blood vessels, which eventually damage and weaken them throughout the body. When the blood flow to the kidneys is restricted, it may no longer function properly. When the kidneys stop removing waste and extra fluid from your blood, the excess fluid may raise the blood pressure even more. When the kidneys start failing, there's a buildup of fluid in the lungs. This can cause shortness of breath. When the lining that covers your heart, known as the pericardium, becomes inflamed, a person may also experience chest pain. When the kidneys don't do their work well, the heart is under stress. The heart needs to pump harder to get the blood to the kidneys. When renal failure takes place, there's a toxic absorption from the inflamed kidney into the body. A headache is the body's reaction to these toxins. When your kidneys fail, there's a cycle that's being established where the headache comes from the toxins in the body, and when the body reacts, it raises the blood pressure, which in turn causes a headache. This is an almost impossible cycle that's established. It's always difficult to determine the cause of a headache, as the reasons could differ vastly and could come from many other sources other than kidney failure. Strangely enough, Kidney failure can cause the sweat glands in your skin to shrink and cause extreme dryness. The body manufactures chemicals that cause allergy symptoms like itching. The onset of the itching may be gradual, but when a person has full-blown kidney disease, the itching can be life-disrupting. As the disease progresses, so does the decline in mental sharpness. It may sound a little strange, but kidney disease seems to be a model for facilitating accelerated aging. Chronic kidney disease may be related to cerebral small vessel disease, as well as the overall impairment in white matter integrity. Finally, men may experience erectile dysfunction as part of the development of this disease. This is caused by low testosterone levels due to the mechanism failing when kidney disease becomes a reality. In the early stages of the disease, you may exhibit only a few signs. Treatment can slow down the progression, but seldom, if ever, stops it completely. The final stages of the disease can result in artificial filtering, commonly known as dialysis, and ultimately a kidney transplant would be needed. Be on the lookout of any of these symptoms, and if you detect more than one of these, it's surely time to ask the doctor to check your kidney function. As there is no cure for this disease, the best thing that you can do in life is to look after your kidneys when you're younger, to the best of your ability. We trust that this video was helpful. Share some new insights that you got in the comments down below. Subscribe to the channel, and when you click on that notification bell, you'll be informed the moment new content is released on our channel.